So yeah, you do have some experience in the emergency department during COVID times. When did you first realize that like COVID was becoming a thing, and when did it start getting really bad?
I was at the end of my third year at a rotation in Corpus Christi doing a pediatric rotation. And they,
Hey there, welcome to another episode of the podcast. My name is Jericho. Today I'm super excited to be here with Lenexa. She is a fourth year med student at UTMB in Galveston, Houston, Texas. She's going to talk about her experiences in med school, and she's also going into emergency medicine. So she's going to talk about her experiences in emergency department during COVID as well, which should be very interesting to talk about. But yeah, thanks for coming on the show, Lenexa.
Thank you for having me. I'm really happy to be able to give back to AED. I started off in this program, and this is kind of what made me pick the path that I'm on. So I'm really grateful for this club.
No worries. So a question I always like to start off these things with is what made you want to pursue medicine in the first place?
I think I'm one of those people who kind of knew that I was going to go into medicine at a very young age. You know, when you're in preschool and you make those posters of what I want to be when I grow up, I always wrote doctor in the blank. For me, I think I was really influenced by children's books, actually, choosing medicine. There's a book that I grew up with called Miss Rumphius, which is known as like the Lupine Lady. I don't know if anyone's read this before, but her entire mission was to make the world a more beautiful place. And I kind of decided on, like, very early on, that my role in making the world a more beautiful place was going to be treating patients with medicine. And so that was the path that I took. And, you do the whole pre-med recs, shadowing, and trying to figure out what your niche is. And that's kind of how I chose my path.
All right, cool. So I wanted to dive straight in actually to your pre-med experience. I was looking through your resume and stuff, and it seems like you've done a lot of really cool stuff. But so, do you have any tips for anyone who's a pre-med right now? What kind of things should they focus on when they're kind of crafting, I guess, their application for med school?
Oh, yes. So I think it's really important you don't need to know what specialty you're going into as you apply for med school. It can be something really fluid. You just need to know what your purpose is in medicine. Like everyone always says, I want to help people, but kind of refining that, because you can do many other specialties. You can be a nurse, you can be a tech, you can be a social worker, and you can help people. But why are you choosing medicine? And I think it's important for people to recognize that what goal is for them, and so you're going to medicine for the right reasons. Once you've established that, I think things that you should be involved in are community service, demonstrating an interest in medicine either through shadowing or mentoring or volunteering, and something that you can speak very well about, something that makes you passionate, and something that proves that you are a good fit for medicine, which is essentially just being compassionate people, and trying to be with patients in their suffering. So something that would demonstrate that. Research is kind of debatable whether or not you have it. I know many people in my class who came to med school without research, and I know many people who did have research. It doesn't really make a big difference these days, as long as you have some passion project that you can speak very intelligently about. If you started a group or a club, something that shows that you are a leader is very good. It's what I spoke about. Many different things. There's not a set formula, but you'll hear the same thing: community service, leadership, research, and then something that makes you unique.
Okay, so are there any specific things, like I guess, say in the interview, that they particularly like talking about? Like, they would ask questions, obviously, about like they would go over your resume and stuff. Are there any specific things on your resume that they would like, that they were really interested in talking about?
Oh, yeah. So I'm currently in my fourth year. So I'm also interviewing for residency right now. It's all virtual through Zoom. I think it's very similar, both med school interviews and then residency interviews. You must always be prepared for tell me something about yourself or tell me about you. A good approach that I usually have is that I talk about things that I'm proud about. So I say, like, hi, my name's Lenexa. I'm a first gen. I'm from here. I grew up here. This is my background a little bit. And then I say, this is my interest in medicine so far. And I outline the major things that I was involved with in med school that I am very, very proud about. And then I say, outside of med school, these are my hobbies. So I leave it open to them whether they want to pursue and asking me more medical questions, or if they want to talk about my hobbies. I give a both thing so they can choose the flow of the interview. But being prepared for it, tell me about yourself, and then tell me why medicine. Those are the two most important questions that I think people kind of forget about, and they're the most basic to kind of get your foot in the door. If you were going to meet your interviewer in an elevator, we call it an elevator speech, a 5-minute spiel about you, highlighting the most important, unique things about you. So always be prepared with an elevator speech, because you never know who you're going to meet. And you can meet someone on the plane, or I guess not during COVID, that
Yeah.
kind of thing.
Okay. So I guess they just want to know more about you as a person, or,
Yes.
Instead of just like, oh, I did all of these, research and stuff, but they just want to know who you are, like, as a person, I guess. Is that what you're trying to say?
Yes, they definitely want to know about you as a person. Talking about your accomplishments and like the things that you've worked really hard for. Pre-meds work incredibly hard to get to where they are. And I think talking about that journey is maybe more important than the actual thing itself. Your persistence and your determination to push through those orgo classes. If you struggled through that, or your commitment to doing a longitudinal community service project. That journey, I think, might be more important than the actual assignment itself.
Okay, makes sense. Okay, so now we're going to transition a little bit into med school now, your experiences there. The first few weeks of med school, what was that like? What was the transition like going from undergrad to med school? How were you feeling during that time? What was it like? What was the transition like?
So for me, it was a little bit chaotic. I went to school during Hurricane Harvey. My first week of med school, I had a week of orientation, which most med schools will end up having like a week of orientation. Some schools have like a boot camp before you start med school. So every school is a little different. But at UTMB, we had a week of orientation, and then we went straight into anatomy. And we had our orientation week. At the end of orientation week, Hurricane Harvey hit. We were out for the first week of med school, didn't see the anatomy lab, didn't get to really like make those. We had an opportunity to make friends during orientation, so that was good. We had a few contacts. So we were a little delayed in terms of that. And that adjustment was a little hard for our class, but I think we bonded through that as we tried to shelter in place together during Hurricane Harvey. But I think the transition in terms of studying is a little different. We have every curriculum is a little different, but at UTMB we have quarter tests. So every 4 weeks we'll have an exam, and there's usually not any homework or assignments in between, very similar to college, but I think the studying technique is very different. I kind of got through college with studying like a weekend before, not the night before. I was not that good, but a week would be more than adequate preparation. With med school, I think it's something that you have to sit down and do every single day. It's not something that you can put off to the weekend and study and hope that it works out. Medicine is a longitudinal game, and you have to retain this information for the next 40 years of your career. So there's no such thing as cramming in medicine. That does not work at all. Maybe with stats, if you want to like memorize formulas. But none of the medical topics are crammable things. So that's a different approach. In terms of lifestyle, I think, going to college is a very big step for a lot of people, and that kind of independence comes with, like living by yourself and, like cooking, making sure you have a good work-life balance. If you take care of yourself, you can do well in school. If you are unable to take care of yourself, you're going to struggle. So I think that's important to know yourself really well. And have good roommates if you're going to do that, and that kind of thing, like that good preparation outside to prepare you for, just focusing on school.
Okay.
You do have free time. Yeah.
Okay, that's good. You do have free time. What kind of things, I guess, when you're really in the thick of it, when you're starting to get a little bit burnt out, what are some things, I guess, that you do to make sure your mental health is good throughout this process and things like that? Yeah.
So I think it's really good for people to hold on to your hobbies, things that you did during undergrad and high school. You can definitely bring with you to medical school. You definitely have, depending on your curriculum, at UTMB we do 2 years preclinical or didactics and lectures, as well as going into the lab, like anatomy lab and those kinds of things. But we also do, in our 3rd and 4th year, they're more clinical rotations, and you're in the hospital 6 days a week almost. And you get 1 day off, most services. The first 2 years, the way our curriculum was built is that we only had to be present for, 3 days a week, like in person. And then we had a lot of time off to structure our own study schedule. So things that I did in my free time was a lot of art. That's my main hobby. And then now that I'm in my interview season and things are much slower and I don't have as many rotations, I've also taken up learning to fly. I would like to be a pilot. So Mhm. So you can definitely have hobbies, and kind of structure your time around that. I know a lot of kids, like not a lot, I'm not gonna call them kids, but like a lot of my classmates have kids. And so that was really interesting for them trying to find work-life balance, and like family time as well. But you can have a family and be in med school, and you can date and be in med school. But you need to set those expectations early on, and like we have like spouse support groups and family support groups. So I think that really helps too.
Oh wow. Okay. So how much time do you think you would say you spend like studying in med school or something? Does it take up like really like the majority of your time, or you say you have some free time in med school? Is it something that you have to kind of block off to really like make time for or something?
hmm So I think everyone has a very different approach into how they study. Like I said, you most people quickly like they learn very early on that you have to study every day. So I usually some people do it by time. So some people say I am going to have all my classes in the morning, which is most of our classes. They're either morning or afternoon. You don't really pick. There's just like Monday, Tuesday, Wednesday is morning classes, and then like Tuesday there's one afternoon class. So then you say, like, I'm going to study until 5 p.m. and then I'm done. Or some people say, I have these lists of tasks and I'm going to study until those tasks are done. It doesn't matter the time. I typically was able to have pretty much every weekend off, like Saturday and Sunday, except for the 2 weekends before my exam. I would dedicate both of those weekends to studying as well. But during the week, I think I would finish at around 6 or 7, and I would have like the evening off to just chill.
All right. So I guess as long as you just make time for it, you can always have free time. That's a good thing to know, for
hmm
sure. What are some things that were better or worse than expected in med school? Maybe when you were thinking about med school in undergrad, what are some things that are better or worse?
So I think for me, some things that were better was it was much easier to be independent and make friends. I grew up in Dallas, so going to UH, it was a big change for me, like living by myself and doing those things on my own. And so that transition from Houston to Galveston was very easy for me, like having that independence, learning to take care of myself. That came fine for me. I know some of my friends who didn't have that opportunity to like be away from their family. It was a very difficult adjustment period, and they would go home on the weekends quite frequently, and you have time to do that. So that's what they would do. And our classes finished very early on Fridays, so they were able to do that and go home and that kind of thing. So I think in terms of independence, that adjustment period is easy personally for me. Something that was difficult was figuring out how to study. Everyone has a very different study schedule. Sometimes people need to be alone to study, and sometimes people really thrive with group work. So I think for me, I took anatomy and physiology when I was at UH. Um, I don't really have any recommendations if you should take that or not if you want to prepare, because it didn't matter. We all kind of entered in the same playing field, because what you learn in med school is a whole different level than what you learn in college. I didn't really, I mean, I had that background and I didn't really feel like it helped me specifically. Maybe I understood a few more things about neurons, but eh. Um, I learned that I did well with the combination of group study and individual study. So yeah, that was something interesting to learn how to study.
Okay. How would you, I guess, do you have like any analogies for what like med school coursework is like compared to like undergrad? Like, is it just like, I don't know, say you're taking like 30 hours of like college work a semester or something like that? Like, do you have any
So
comparisons?
let's compare. I took biology with Dr. Newman in the Honors College, so at UH, and I would say that it is similar in terms of length of lecture. We have like maybe 3 or 4 lectures per day. So it's like you going to like bio and then chem and then biochem. Let's say that, like that much amount of time in class. And then outside of class, you are constantly reviewing that material. So I would at least duplicate that time to re-go through that stuff. Now, you'll learn in med school that people sometimes don't have to go to lecture, and you can double speed the lecture and blow through it. But sitting down and studying, I think that it's a lot more time because you know that you can't forget it. You have to remember all the information, not only for your 4-week test, but also for your 8-week final, and then again for your board exam. You cannot skimp on learning that stuff. So you have to put in a lot of time, I think. So yeah, I would say like you pretend like you have a 40-hour work week and then go with
40-hour
that.
work week.
Yeah.
Okay. So just a lot more studying, I guess, obviously, than undergrad. Okay. But yeah, it seems like as long as you put in the effort, you can adjust pretty well. So that's a good thing to know. But yeah, you are a 4th-year med student. You're thinking about going into emergency medicine. What made you pick emergency medicine, I guess, over other specialties?
Yes. So this is where my connection with AED comes in. When I was a sophomore at UH, I had we had like an evening, like 5 o'clock meeting that we usually have like on a Wednesday. And I remember it was like fall of 2014, and we brought in a doctor, a peds emergency medic. When I say peds, it's pediatric emergency medicine physician from Texas Children's, and she was an amazing orator. I don't know where we found her; she was fantastic, and she just spoke about her specialty. She spoke about the role that she had in medicine and her duty and the thrill and excitement that she felt. And I was just so taken with her that I approached her after our meeting, and what ended up happening was that I ended up doing a research internship with her, and I ended up shadowing her. And I was very influenced by like that taste of emergency medicine, that's how I knew like this is my specialty. It was so fast paced and quick. There's no clinic, so I have a short attention span, so I can't really handle clinic too well. So, and there's no call. It's a very nice, lifestyle. You don't have to be in the hospital 24/7. You work your shift and then you get to go home. And I think those are like the good lifestyle points, but also I really love the patient population. You see women giving birth and you're helping them bring that baby into the world, or you see people at the end of their life coming in for a code, that they might not make it. And you have a broad range of ages and you have a broad range of complaints. Like you can have someone who has appendicitis, which is very serious and an emergency, or you can have someone who's coming with like, I stubbed my toe. This is an emergency. But being there for each patient at their level is a very good personal social skill to try and meet patients where they're at. And I just really love that idea. No one forgets a trip to the emergency room. So I think it's like a very good idea, to be like that nice, compassionate person who's going to make that entry for them into healthcare a very good, smooth transition for them.
All right, that's cool. So yeah, you do have some experience in the emergency department during COVID times. So I want to talk a little bit about that. I guess we can start in the very beginning. When did you first realize that like COVID was becoming a thing, and when did it start getting really bad? Were there any changes made in the beginning of your clinical rotations due to COVID?
Yeah, so when COVID was officially announced to medical schools, it was after March 8th, I believe. And the AAMC, which kind of helps with kind of making overall decisions for medical education, came out and they said we need to implement a 2-week suspension for students who are on their clinical rotations. I was at the end of my 3rd year at a rotation in Corpus Christi doing a pediatric rotation, and they immediately pulled everyone out of patient care. I actually had a few COVID cases over in Corpus, and we would gown up and then, gown, glove, surgical mask, N95, face shield. We even had our helmets back then. And we over in Corpus, we're trying to limit only the physicians to see those COVID patients. It was very important that students didn't have any exposure because, no one truly understood how COVID worked, and, no one wanted to put students in jeopardy. Now it's very similar. We don't want students seeing COVID patients. Now, in the emergency department, it's a little different because sometimes you might not always know. Sometimes your patients might not be symptomatic. The way most emergency medicine departments are now approaching it when in terms of relations with students is that you will do the rapid test, which is a swab, and it usually takes about 15 to 30 minutes to get it back. And if the patient is COVID negative, you can go see the patient as a student. My experience has been a little different in terms of trying to figure out, like, okay, you can't let the patient sit there for 30 minutes. So you do your due diligence, and you gown and mask, glove, face shield, and you can see the patient like that. It's a different combination. I rotated in a couple different places. So people had different approaches, but the schools did an amazing job at making sure that students had good PPE and making sure that they were well protected. And there's no obligation for students to see COVID patients, but I personally think it's a very good and important part of our education to know how to deal with these very important things in medicine. COVID isn't going to go away anytime soon, so I think it was important for students to also learn how to interact and how to properly protect themselves and gown. There's a process to putting the equipment on, and there's a process to taking it off. And I think like learning to don and doff that equipment was very important for students.
Okay.
Mhm.
So your first few cases, you saw some COVID cases.
Yes.
What was it? What was it like seeing it? Like how are they presenting? I guess how are you feeling during that time, just seeing them?
So some people would come in with not very serious symptoms. They'd be congested. Some would come in in very severe respiratory distress. And at the beginning, we were intubating patients. We thought that that was going to be good for them because their oxygen saturation in their lungs was very, very low, like 80s, 70s, even lower. And so for those patients, like how do you protect their airway, make sure they're satting okay? You would intubate them. But then we would find that despite intubating them, they had so much fluid in their lungs and so much infiltrate that it wasn't very effective. So then we stopped intubating patients like that, and we would tell them like only. And the problem is that there's a lot of boarding and overcrowding in hospitals now because hospitals are full of COVID patients as well as other patients, and so sometimes we don't have the capacity. Like Texas Medical Center was eventually a couple months ago, they were at 98 percent capacity. And even in our hospital, we were very, very full. And so sometimes we don't have beds. Even if you're so sick, we don't have beds. And so that's why it's really important to, teach the public health education is very important, you know, social distance and like wear a mask. Those things are important because we don't have the space to care for you sometimes. And I think that's very difficult. It's very difficult to see. And so, if you had mild symptoms, you would go home, quarantine, and only if you got really, really sick, come to the emergency department. Um, and so you kind of saw a very broad range of those kinds of things. They did a really good job in trying to help doctors stay safe. We built like these acrylic intubation boxes, which didn't really last very long because they weren't it wasn't good to try and like maneuver in there. So then they just kind of upped the PPE. And eventually we kind of stopped intubating the patients because research just kind of showed that it wasn't very effective. So those kinds of things happened. You see patients really, really sick. We would lose a couple of patients as well. But many have made it up into the floor, made it up into the ICU, and many have walked out of the hospital healthy. So, I mean, some of them have lasting effects, but they were able to leave the hospital.
All right. Did you see any particularly like bad cases or something, or was it really just were they a lot of them like on ventilators or something like that? You always see on like the news and stuff. But what was it really like just walking around and seeing, the COVID patients in the hospital?
So we have several COVID units at UTMB. Students are not allowed, but they're trying to avoid putting students on those rotations. And I had already finished the internal medicine and family medicine rotations that were taking those patients. So I was not up on the floor, but I did more emergency medicine work with those patients. But many of them, once stabilized in the emergency department, would go up onto the floor and was be taken care of by the floor team. And it is very serious. You have people watching to make sure that when they're entering and exiting those rooms that you're not contaminating other people, and you're not it's like a negative pressure room, so you don't have the spread of the virus and that kind of thing. But I think it's being vigilant and making sure that you're sanitizing and those kinds of things. I think that's where it became much more important. You always see like gel in, gel out of rooms, and that's taking that to a whole nother level, to make sure that everyone's safe. So I think that in terms of that, I think that's was much more rigorous.
Okay. Um, has it changed, I guess, how you view medicine at all? Just seeing like the gravity of the entire situation. COVID is, something that affecting everyone globally. Has your experience seeing the COVID patients like in person changed how you view medicine?
I think for me, it kind of strengthened the idea of how important public health was. It's something that many pre-med students kind of do research in, public health, but like, what does it really mean? It means like, how do you take care of a community? And then how do you educate that community about medicine? And you have to be able to cater to many different education levels and many different beliefs. And you have to also be able to refute like false information about the things that are not true about, the virus and things like that. And so that's a very important skill for medicine. You need to be able to communicate with your patients. You need to be able to explain their diagnosis to them and help them understand it. Because when patients understand the diagnosis they have a better opportunity of being able to care for themselves when they go home. And they have a better opportunity at understanding like why the medications are important. Why do they need to, take care of themselves in this particular way that the doctor says is the best way? And talking to your patients and educating them is probably the most important part in making sure that people get better. So I think that public health education really came to the forefront during the pandemic, and it's something that every physician does with their patients, but I think it took on a whole new role of importance and emphasis. So I think that was very important for me, at least when I sit down with patients. It's, you take that extra moment to make sure that they understand it, and you ask them like, can you repeat that back to me? Or like, how did you understand the information that I presented to you? Because sending them off without proper information doesn't help the patient in the long term. So they'll come back to you. Um, so you need to make sure like that is taken care of. So public health education, I think, was incredibly important during the pandemic.
Okay. Um, I guess to end things off with a little bit, you've gone through med school, you've done the whole pre-med thing. What are some things, I guess, you would tell your past self about this whole journey, going through pre-med, med school, and now going into residency?
It's a long journey, and there are many times that you feel overwhelmed. And you feel like, oh my gosh, the studying never ends. I think that was very, very difficult as between undergrad and med school, is that your studying never ever ends. Education and learning is a lifelong process. And for me, I never really understood what that meant until I came to medical school. Whereas, you have a certain number of biology topics to study for the test, what's going to be on the test, you study those things, you take the test, it's done. For med school, it's like, okay, well, here's this information about this process. I could read it in this textbook. I could watch this video. I could read it in XYZ. And you learn one extra fact about it every single time. And so you never know, I think, where to stop and like how much is enough until you've taken the test, and then you realize where your level should be. And that's why it's important to do practice questions to like know where you need to be at. But I think like lifelong education is probably like understanding that is probably the most important part that I had to learn about the journey between pre-med and med school. And now transitioning to residency, I am so glad that I spent the last 25 years of my life during this journey. Everyone has a different journey, but for me, it's probably gonna be the best thing that I have done thus far in my life. And I know I'll go on to do many other things. And I think becoming a physician is something that I'm incredibly proud of. And you should always remember where you came from and try and give back to those places that helped you get to your end goal of becoming a physician, because you can do something good for those students who, are also trying to follow that path. And always coming back full circle, I think, is important, just so you can help others, pursue their dreams. I think that's very important.